Hi, my name is Mike Smolinski, and I'm the managing editor of Neurology Now. With me is my editor-in-chief, Dr. Brey. Hello, Dr. Brey.
Hello, Mike.
And we are attending the 2013 American Academy of Neurology annual meeting. My first question for you is, you could explain maybe to our readers and viewers what the AAN annual meeting is and why it's so important.
Well, the American Academy of Neurology annual meeting is a very important meeting for many, many neurologists. About 10 to 12,000 neurologists all come together once a year to learn about the most recent updates in treatment and in diagnosis of various neurologic diseases. And a lot of extremely important research findings, new research findings are actually presented here, which then can be, are important in terms of translating into treating patients with those conditions.
Mm-hmm. And is there any research coming out of this particular meeting that you think would be of interest to our readers of Neurology Now?
Oh, there's really a lot. In fact, there's actually too much to mention specifically, but I do have a couple things that I want to really highlight that I think are quite important. Mm-hmm. And one is the finding that will be presented at this meeting that concussion, especially multiple concussions, is an extremely important risk factor for developing depression. So this was a study that was done in NHL athletes, but it really has implications for people in the service who sustain head trauma, or just anyone who sustains a head trauma. And that is that multiple concussions make you more likely to develop depression, and you really need to be aware of that and looking for it so it can be treated.
It's really interesting because I think most people, myself included, think of depression as a psychological or purely psychiatric condition and don't think about the way that the brain, the physical brain, can affect depression, can be the source of depression.
Well, we know that depression is a brain disease. Mm-hmm. There are imaging studies that have been done that show that certain areas of the brain change when depression is present and then change again after it's treated. So there are specific brain areas that mediate depression.
Really interesting.
Absolutely. Now, another very interesting thing that I think is important for a lot of people, and that is that blood pressure, elevated blood pressure, is linked with the development of dementia. There was a very large study that was done on a cohort of people in Hawaii. And these patients were looked at in terms of whether they had high blood pressure and how their blood pressure was treated. And what the researchers found was that people whose blood pressure was not treated had a much greater risk of developing dementia. And they found that treatment of high blood pressure with a specific medicine called a beta blocker was the best protective factor for developing dementia. So the key message here for many, many people is that high blood pressure needs to be treated for a whole variety of reasons. It's a risk factor for stroke and for heart attack, but it's also a very significant risk factor for developing dementia.
I mean, it seems like important information because high blood pressure is incredibly common.
It's incredibly common, absolutely. And then I'll just talk about one more important bit of information that's going to be presented, and it also has to do with depression, and that is depression after stroke. Researchers found that stroke patients very commonly develop depression. And if they develop depression and it's not treated, they're at a 3 times higher risk for having another stroke, for having a heart attack, or for dying. So again, the link, as we talked about earlier, between depression and brain is really being highlighted at this meeting.
I know that a couple of issues ago you wrote your editor's letter about the impact of depression in neurologic disease, and we have done recently some stories in part because our readers have asked us to talk about it more. So it seems like that's a really important topic that people are looking into now.
Very much so. Very much so.
Dr. Brey, thank you very much for taking time.
Absolutely.
And we'll see you next time.